Welcome all. Today we are going to see a topic in gynecology, that is benign neoplasms of the ovary. It is an important essay question. So we are having 6 important benign neoplasms of the ovary. First one is mucinous cyst adenoma, serous cyst adenoma, Brenner's tumor, dermoid cyst, endometrioid tumors, clear cell tumors. So you can remember it easily with the mnemonic, my sister bakes delicious cupcakes every Christmas. So this is mucinous cyst adenoma, serous cyst adenoma, Brenner's tumor, dermoid cyst, and this one is clear cell tumors, endometrioid tumors. So these are the 6 benign neoplasms of the ovary. So first one is the mucinous cyst adenoma. This is an epithelial ovarian tumor, and the cells in this ovarian tumor are filled with mucin. So it is named as mucinous cyst adenoma, and this is the second common epithelial tumor. And in naked eye appearance, it is the largest benign ovarian tumor. It is smooth and lobulated. Cross-sectional appearance contains thick viscid mucin, and it is multiloculated. As we've seen earlier, it is a lobulated one. It appears on cross-section as multiloculated. Mucin itself is thick and viscid substance, so the content includes thick viscid mucin and multiloculated. And microscopic appearance, it is made of one layer of tall columnar epithelial cells with basal nuclei. It is made up of single layer of columnar epithelium. So it is an epithelial ovarian tumor, largest tumor. It is filled with mucin, and it is multiloculated, lined by one layer of tall columnar epithelial cell with basal nuclei. So this is about mucinous cyst adenoma. Next we will see about serous cyst adenoma. Serous cyst adenoma is also an epithelial ovarian tumor. It is bilateral, but it can be multilocular or unilocular. And the main important point is it contains surface papillary projections are often present. In naked eye appearance, papillary projections are present. It is also smooth, shiny, greyish white adenoma. The content fluid is clear, and it is made of albumin and globulin. So next about the histology. Histology is it is made of single layer of cubical epithelium. So about serous cyst adenoma, it is also an epithelial ovarian tumor. Surface papillary projections are present. Content fluid is clear. It contains of albumin and globulin. It is greyish white in color, made of single layer of cubical epithelium. So next important term in serous cyst adenoma is psammoma bodies. It is present in the areas of cellular degeneration. Where the cellular degeneration happens, there is a presence of a calcified structure which is tiny and spherical in shape and laminated, that is known as psammoma bodies. So psammoma bodies are found in cellular degeneration areas which are calcified structure which is tiny, spherical and laminated. So next one is the endometrioid tumors. This is a rare condition. It also contains epithelial cells resembling those of endometrium. Cancer of endometrium may occur. So this is about endometrioid tumors. So next is about the clear cell tumors. It occurs in the age group of 40 to 70 years, and it rapidly aggressive, that is it rapidly increases in size. And clear cell tumors contain hobnail cells. The characteristic feature of clear cell tumors is the presence of hobnail cells. What are hobnail cells in the sense? These cells have abundant glycogen, and the nuclei of these cells protrude into the glandular lumen. So hobnail cells have abundant glycogen, and the nuclei protrude into the glandular lumen of the tumor. So next one is the Brenner's tumor. These are bilateral and solid, and it is less than 2 cm in diameter. It occurs above the age of 40 years, and these Brenner's tumors are similar to fibroma, and it arises from the squamous metaplasia of surface epithelium. So important point about Brenner's tumor is where it arises from. It arises from squamous metaplasia of surface epithelium. Age group is above 40 years, and it is less than 2 cm in size. It is similar to fibroma. So important term here is wall-third nest. Wall-third nest in the sense, in a compact fibrous stroma, there are islands of transitional epithelium here and there. So this is known as wall-third nest. The cells present here contain coffee bean in appearance, and from this Brenner's tumor, estrogen is secreted, and this leads to abnormal vaginal bleeding. So the next one is the dermoid cyst. All the benign neoplasms we've seen previously is epithelial one. Now dermoid cyst is a germ cell ovarian tumor. It arises from the germ cells. It is also bilateral. It contains all the 3 elements of the germ cell layers. So it contains all the 3 germ cell layers, and it may contain thyroid tissues. If it contains thyroid tissues, it is known as struma ovary. We'll see it later. And malignancy risk is very low. Torsion is more common here. So dermoid cyst, the main thing is to remember is it is a germ cell tumor, and it contains elements of all 3 germ cell layers, and sometimes it may contain thyroid tissues. It is known as struma ovary. So coming to the naked eye appearance, it is less than 10 cm, and it is capsulated. So important one is the content. It contains sebaceous material and also clear fluid and also hair. It contains the components of all three germ layers. So sebaceous material, hair, clear fluid, everything is present in the naked eye appearance. Rokitansky's protuberance. So what is Rokitansky's protuberance is, there is a solid projection which is covered by a skin with sweat and sebaceous gland. If it is, imagine it is a dermoid, it contains a protuberance like this, and this protuberance is covered by a skin, and it also contains sweat and sebaceous glands. So Rokitansky's protuberance is a solid projection covered by skin with sweat and sebaceous glands. So the microscopic appearance includes stratified squamous epithelial lining of the cyst. The cyst is lined by stratified squamous epithelial cells. That is, many layers of stratified squamous epithelium, and at places it contains granulation tissue. And common thing in the dermoid cyst is the presence of ectodermal elements. So next is the term struma ovary. If this dermoid cyst contains thyroid tissue, it is known as struma ovary, and this struma ovary secretes serotonin, bradykinin, etc. So next, coming to the clinical features. It predominantly occurs in the childbearing period, and it has no relation with the parity. So what are the signs and symptoms? The symptoms include, it is mostly asymptomatic and has heaviness in the lower abdomen, increased mass size in the lower abdomen, dull aching pain in the lower abdomen, cardiovascular and respiratory system manifestations. Menstrual pattern is not affected. So the main important symptoms in the lower abdomen include heaviness, increased mass size, and dull aching pain. So these are the three important symptoms if present. It is mostly asymptomatic. If present, these are the three main symptoms. So due to this mass or tumor, there may be manifestations in cardiovascular system and respiratory system. So next signs is pitting edema is seen. So these are the symptoms, and these are the signs. Pitting edema is the sign. The symptoms include heaviness, increased mass size, and dull aching pain in the lower abdomen. So next, coming to the examination. Abdominal examination. In inspection, we can see the bulging of lower abdomen. Because of a tumor or mass present, we can see the bulging of lower abdomen, over which the abdominal wall moves freely on respiration. That is, this tumor or cyst is not attached to the abdominal wall, and on respiration, this abdominal wall freely moves on respiration. Next is the palpation. On palpation, we first feel, on palpating, how the tumor feels like, whether it is cystic or it is tense cystic, whether it is cystic like a sac filled with a fluid, or it is somewhat rigid. And next one is mobility. It is freely mobile. As we seen earlier, it is not attached to the abdominal wall and freely moves on the respiration, and it is freely mobile. So borders. Upper and lateral borders are well defined. Lower pole is difficult to reach. And next is about the surface. Surface is smooth, and in lobulated tumor, it is grooved. Tenderness is not present here. So on percussion, center it is dull, and in the flanks it is resonant. If the wall is thin and the content is watery, the fluid thrill is present. Next one is the auscultation. On auscultation, friction rub over the tumor is heard. So next one is the pelvic examination. On bimanual examination, there are 5 points. First procedure is uterus is separated from the mass. Second one is a groove is felt between the uterus and the mass. So next one is on movement of the mass or abdomen, the cervix does not move. On elevation of the mass, the cervix is stationary till then. And third point is lower pole of the cyst can be determined through the fornix. Next one is the special investigations. We can do ultrasonography, CT, MRI, serum tumor markers, that is serum CA125, alpha fetoprotein, beta HCG, and then EUA, cyst aspiration, X-ray, laparoscopy, laparotomy, cytology. So these are the special investigations. The common one is USG, CT, MRI. Then as it is to differentiate as it is as benign or malignant one, we are taking serum tumor markers, that is three things: serum CA125, alpha fetoprotein, and beta HCG. Next one is a cyst aspiration and X-ray, laparoscopy, laparotomy, and cytological studies. So differential diagnosis include full bladder, pregnancy, fibroid, chocolate cyst, functional ovarian cyst, ascites. So there are 6 differential diagnoses. Maybe the bladder may be distended and appears as some mass in the abdomen, or pregnancy, fibroid, chocolate cyst, functional ovarian cyst, and ascites. All these conditions, a mass is present and it may mimic the benign ovary of the tumor. So next one is about the complications. So next one is the differential diagnosis. full bladder, pregnancy, fibroid, chocolate cyst, functional ovarian cyst, and ascites are the differential diagnosis. Either a distended bladder or full bladder mimic the tumor or mass in the abdomen. Pregnancy also goes with the same conditions, and fibroid, chocolate cyst, functional ovarian cyst, and ascites are the differential diagnosis. Next is about the complications. If a pedicle is present in the tumor, there may be torsion of the pedicle, an intracystic hemorrhage may occur, infection may occur, rupture of the cyst occurs, and malignancy is common.